Training session in healthcare, introducing new policy initiatives. Brief summary. The selected role group will be comprised of departmental heads, nurse leaders, and unit administrators. Evidence-based approaches would be needed to work with members of this team. First, a forum will be held whereby the individuals will appreciate some of the milestones and gains recorded in the facility's care delivery processes. The role group will brainstorm and consider unique initiatives to transform the quality of services available to more patients. As the person in charge, I will present the anticipated policy and practice guidelines that can meet the medical demands of more patients. The next strategy is allocating adequate time for the professionals to acquaint themselves with the new policy approaches. This step will be followed by an organizational change whereby all workers will make such strategies part of the established care delivery procedures. Explanation. The intended training session is essential since it will allow the group members to implement the proposed policy and practice guidelines successfully. The activity will make it possible for the participants to brainstorm and identify some of the challenges affecting the process of care delivery. The allocated time will allow the individuals to offer additional insights for implementing the change successfully. They will also commit themselves and encourage them to be part of the process. The selected group is appropriate for piloting the intended proposal due to various factors. 1. The professionals focus on better approaches to improve care delivery. 2. They possess adequate managerial competencies that can improve the quality of medical services. 3. They have the potential to encourage their followers to remain part of the process, thereby reducing the possibility of resistance. Annotated agenda. Introduction, 9 to 9:30. Identification of members present. Analyzing issues in healthcare. Identifying new ways to improve the process of care delivery. Brainstorming and appreciating the need for improved practices and procedures. Recognition, 9:30 to 9:40. Examination of why the facility needs a change. Identification of evidence-based approaches for introducing the proposed change. Training, 9:40 to 10:30. The members of the role group will receive pamphlets. Individuals will have access to the internet and follow the presented guidelines. Members will learn more about the intended policy guidelines and best practices. The individuals will acquire additional insights regarding the need for better services and working environments. Discussions, 10:30 to 10:55. Members will engage in discussions. Individuals identify emerging evidence in nursing and medical practice. They will also identify how they can introduce such procedures. Concluding remarks, 10:55 to 11 o'clock. The training session will be concluded successfully. Training session analysis. Summary of evidence-based strategies. The intended strategies include brainstorming, discussions, and outlining the targeted policy guidelines. Members will offer their views regarding the entire process. An effective change model will support the introduction and acceptance of the new policy initiatives. These strategies will be effective since they will target professionals in leadership positions. They are also evidence-based and practical in nature. The right measures to indicate possible success factors include the involvement of the individual's presented views and the nature of the complaints. Emerging resistance can indicate the possibility of failure, thereby compelling the leader to take the relevant measures. Impact. The intended policy and practice guidelines are intended to streamline the care delivery process. These beneficiaries will acquire new ideas and concepts for meeting their patients' demands. Such professionals will reduce low levels of burnout and eventually become content with their work environments. More people will also be in a position to receive timely, personalized, and high-quality medical services. The use of an effective change theory will support the implementation of the intended policy and practice guidelines. The members will manage their departments and eventually complete their tasks much faster. Justification. As described above, the new policy and practice guidelines will meet the demands of more professionals. For instance, the role group will complete its duties much faster and encourage more people to be part of the process. They will help reduce resistance and ensure that such leaders achieve their potential. Consequently, all beneficiaries and practitioners in the facility will eventually rely on the new practice guidelines to maximize the quality of patient care. Role group's importance. The selection of this role group is an ingenious choice for supporting the implementation of the policy and practice guidelines. Such members are skilled in leadership and can handle emerging challenges. They are aware of the best approaches to implement change effectively. Their acceptance or work and buy-in will reduce the chances of resistance and eventually make the process successful. As the person in charge, I will give all members adequate time and encourage them to brainstorm. Instruction content, learning activities, and materials. The intended instructional content includes aspects to do with improved care delivery practices. Individuals will engage in discussions and identify areas of weaknesses. They will then analyze emerging models that can meet the health demands of more patients. Individuals will require an internet connection, writing materials, and pamphlets throughout the training session. The discussions and brainstorming activities will allow the role group members to identify initiatives that might work or not. The concept of continuous learning will present the best activity for agenda learning and skill development. These efforts and initiatives are simple, thereby making it possible for me to complete the training session within 2 hours.